With reference to yesterday class, we'll be discussing the types of letter over here. So you can see over here, like the most common type of letter in OET writing, specifically for the medicine and rarely for the nursing and rarely for the pharmacist. But we must know the rules and regulation of writing the referral letter. So to begin with, we would say two cases for specifically OET medicine with a diagnosis given, right? Or without a diagnosis given, right? So we can have the assessment if you have diagnosis given. We do have the symptoms or sometime even a situation. So we have diagnosis given, right? And sometime we have a situation, right? Anyhow. So let's say starting with the simple case with assessment. Now we are writing this letter to the cardiologist. The first question of the yesterday lecture that you had to ask from yourself that to whom you're writing this letter. Let's say we're writing this letter to cardiologist, and we can see. Let's say this is your writing task. Over here, you can find. Let's say write a referral letter to, let's say, a cardiologist for urgent management. Let's say. So what this is the reason of writing? We are suspecting based on the symptom. Let's say AMI. Now this is the first case with a diagnosis, right? So I will try to make the case notes. Then you can write it down. For example, the patient presenting complaint would be chest pain. So in case like we are suspecting AMI, so we are you can see in the case notes, let's say we can have 3 to 4 visits. Okay. So we can have, let's say, 3 to 4 visits in these writing. As we mentioned, let's say if the person is coming to you with mild intensity chest pain from the first visit, again we have mild intensity chest pain, and again we have mild intensity chest pain, right? In all of the visits, so let's say, and we did not have any significant finding in examination in all of the visits, right? Like I'm just writing the chunk of the case notes. So let's say this is today visit, the most important details, right? And what we have now, the intensity of the pain has changed to crushing chest pain. Now we can see that intensity of pain has changed. So previously we will be writing, like previously we can see in the first visit, second visit, third visit, maybe margin of like 1 week or maybe 2 week, whatever the margin is in the case notes. But the intensity of the pain was mild, right? And now in today's presentation, the first thing that may caught your attention is that the patient presented with crushing chest pain. And in the other associated symptom, for example, whatever symptom that has been associated with the chest pain has been written, like it radiating towards the right side and left side, whatever, followed by the most significant finding of the examination. So let's say in the ECG, you found something significant such as ST elevation, right, in the anterior lead. And based on that, you had made an assessment of AMI. Now, this is a simple case. You can see that this is a case with diagnosis. Now, it's easy comparatively to present this case. So, how would we present? Try to remember what we discussed because I'm going to like just remove this thing. Try to remember our discussion. So, when we'll be writing the introduction, I have certain convention to write. Let's say I'm can write it down. I'm writing to refer. This is also a convention. I can also write down. I'm transferring. Let's say if it's a ambulance transfer being involved, Mr. XYZ via ambulance, right? I can also write down thank you for seeing, let's say. Okay, just give me
Sorry
a
for
moment.
interruption, sir. Can you please record, sir?
I'm recording, sir. I'm already recording.
Okay, thank you, sir.
I'm already recording. Because some of you would join late and there might be some internet connection on my end or your end. So in that case, for that reason I'm recording, right? Just a minute, there is some candidate who's waiting, so I can add her. Okay, fine. So basically, if you can see, these are some convention. I'm writing to refer. I'm transferring if we have mentioned that transport is being involved, like I'm transferring Mr. XYZ via ambulance. Thank you for seeing. And in this case, if it's a you can say if the transport is involved only, in this case, we can write down thank you for, let's say, accepting in case of transfer letter. Anyhow, so all of these are the conventions. You can write any one of that. So let's say I can write one convention with you right now to make you understand. Yep. Thank you. If this is an urgent case for seeing this patient, or I can write down thank you for seeing Mr. Let's say whatever the name is on urgent basis, whose I can write down signs, symptoms, if he has symptoms, and investigations are suggestive of, let's say, AMI. I will write in full form, but here I will write in short form. But in the exam, you have to explain it, okay? For okay, for further management, let's say I can write it down, right? Or I can simply write down, thank you for seeing Mr. X on urgent basis, whose feature are suggestive of AMI. Now, a particular to the case when we have assessment or diagnosis given, whatever the diagnosis is, if it's a like if it's diabetes mellitus, if it's inflammatory bowel disease, for example, if it's let's say we can say early oral obstruction, okay. If we are suspecting ischemic heart disease, let's say, think of any possible diagnosis that one can expect. You can write in this way in a case when we are writing a letter of referral with diagnosis, right? Is it clear to you? So now we can discuss the letter without diagnosis so that you can understand. First one was with diagnosis, and now we are writing this letter without diagnosis, right? In a case when we don't have the diagnosis. So I will write it down things for you. For example, we have some investigation given in the case notes, such as your, let's say, any blood test which show your blood sugar of 11 millimole, right? We have another finding, albumin in urine that was fairly increased, right? Okay. We also have, let's say, no sugar in urine. We also have, let's say, blurred VN and side sports. And now we are writing this letter to the endocrinologist. Now, now this is the case. We don't have the diagnosis, but we have the symptoms. So how would we write down the introduction of this letter? So some candidates just make a mistakes by interpreting these case notes from their medical knowledge. They write down, let's say I'm writing to refer Mr. XYZ, whose sign and symptom are suggestive of diabetes mellitus. Now, in this case, this introduction would be totally wrong. because there was no diagnosis mentioned anywhere in the case notes. So we are not supposed to add something from our own knowledge. So that particular case can be written in just, let's say, this way. Thank you for seeing Sir or Mrs. XYZ who presented with high blood sugar, confirmed in, let's say, blah blah test, coupled with or along with sorry, any of the major symptoms that you want, along with, let's say, side sports or blurred vein or albumin urine or increased albumin in urine, whatever you believe as per the case notes, you can write it down, right? For a definitive diagnosis and further management, right? So now we have discussed two cases with you. A case with diagnosis such as AMI was given, and case then we have only symptom given. So both of the case has been discussed with and without diagnosis for your understanding, because sometime we would have the case then we don't have the diagnosis given, rather we just have the symptoms. So as all of you being a healthcare professionals, doctors, maybe nurses, maybe pharmacists, maybe you might be inclined toward the case. You might be inclined toward the case and you can be judgmental, like by just inferring something from your knowledge. So we are not supposed to add anything from our own knowledge, right? So at this point of time, would you like to ask any question?
Can you please elaborate the referral case for pharmacist when there is a drug-drug interaction
Mm-hmm. And to whom we are writing this letter?
to the physician?
To the physician, right? Okay,
Yeah,
fine.
for change of medicine or removing from the prescription.
From change of medicine and from removing from the prescription.
Yeah,
So
yeah.
basically, as you now we discuss about the first two types of the letter, which includes your referral, first two types, with diagnosis and without diagnosis, right?
Yes, sir.
Right. So now the further types of the letter with diagnosis, let's say we have discussed, and without diagnosis, right? So we do have further splays from these two major types. So let's say we move on toward the with diagnosis. If we have discussed the case that was there with diagnosis, as we can see, now we do have second case. Here we are discussing a differential diagnosis case. When we have DDs, so how would we write down that particular case, right? For example, as per the discussion of the first writing task, you can see, let's say now we will just try to add more thing over here. We have chest pain that was mild in intensity, and the second symptom was mild asthma. So let's say from top to bottom, in today's visit, it's crushing pain, right? The nature of pain is crushing, and its asthma has worsened.
सर अब आपकी आवाज कट गई है
सबको कट के आ रही है, सिर्फ आपको कट के आ रही है?
कट रही है सर.
जी,
अब ठीक हो
It's
गई है
clear. So it's clear now.
ओके. सो बेसिकली अगर आप इसको देखें तो वी हैव a case that we discussed previously, a case with chest pain with mild intensity and mild asthma. Patient presented to you. All the findings are normal, except that the asthma has been worsened down the grade, like worsening of asthma, and he presented again with crushing chest pain and worsening of asthma. And you have DDs, let's say AMI, APO, and worsening asthma. So we have two DDs, either it's AMI, either it's APO, based on the symptoms and investigation, whatever, right? So there are two formats. If we have the DD is given in the assessment part with APO. So we can write it down and along with that worsening asthma, right? So we can write it down either this case in this way. Let's say I'm writing to refer Mr. XYZ. Let's say whose features are suggestive of, let's say, uh, acute myocardial infection in full form or acute pulmonary edema in full form, along with worsening of asthma.
सर आपकी स्क्रीन नजर नहीं आ रही है
सबको नजर नहीं आ रही है, सब आपको नजर नहीं आ रही.
पता नहीं मुझे तो
Okay, so we have this. I'm ready to refer Mr. X. Whose features are suggestive of AMI or APO, along with worsening of asthma. Again, for a definitive diagnosis and further management, right? So now you can see this is one of the case you can write down the differentials. And second way, I will explain to you as well. Now we have another case, for example, of read is patient presented to you with the following history.
आवाज नहीं आ रही.
जी सर, मैं बोल रहा हूँ, बोल नहीं रहा अभी. So let's say this is another case. We have the subjective, like the presenting complaint. Patient presented to you with, let's say, sudden onset of left lower abdominal pain. This is the intensity of the pain. It was sharp and constant. The important negative finding. And from the last 3 days, the patient had not passed any stool. And last was with blood. It was confirmed on the examination that on light palpitation, it was very tender. Left lower abdominal pain. HB was mentioned. And you made an assessment that it is obstruction, possibly due to diverticulitis or carcinoma. We don't know. So, with reference to two cases that I've discussed, I can write down the introduction in these two ways. First one, in the last letter I mentioned, and in the second letter, you can see that I can just write down this as a differential. Thank you for seeing Mr. X, who presented with, let's say, left lower abdominal pain along with 3 days history of, I will write in full form, make sure, 3 days history of absolute constipation, right, for a definitive diagnosis. And further management, right? So, with reference to two discussion, the first one we discussed the case and we have mentioned the details in the introduction, and the second one we can mention about the presenting complaint, right? So these are two different format of writing the differential letter. If you like to ask any question at this point of time, please feel free. Now we have the third types of letter. Sorry, that we will be discussing over here. It's your letter of discharge. Now, letter of discharge is important letter. It's very rarely in the medicine, but most common letter in nursing. So understand the concept starting from the OET medicine. In the OET medicine, as we discussed yesterday, discharge is the flip side of the referral. So in your case, always you are getting is a referral back, right? So specialist will be writing this letter back to GP. So this person, he is a primary care physician. So basically, we already discussed social history, not relevant. Past medical history, most of the case not relevant. We do focus on the ward management, but it should be written in summary. If we have nursing management, so we have to expand. If it's your discharge plan for the nursing management, so this is the focus of writing in a letter of discharge. So what we can see over here, writing a letter of discharge, let's say a specialist to GP referral. Now think of the possible scenario. For example, the surgeon is referring back to the GP after performing the right total knee replacement surgery, right? So in this case, the surgery has been done. In this case, the specialist is referring back to GP, and where the person has performed right total knee replacement, and he is discharging for a follow-up. And there would be some point written in follow-up. Let's say whatever the point. Just a minute, please. I would appreciate please mute your mic if there is distortion from your back. Okay. So basically, if you can see over here, so we have the specialist to GP referral back. The patient has our right total knee replacement surgery that is successful and uneventful surgery written in the case notes. And we are writing this letter for follow-up. Let's say the first thing is to encourage the patient to use, let's say, trial or trail of stick or frame as per requirement, right?
Sorry sir, writing आपका we cannot see.
Sorry, ma'am.
It's not. Are you writing or only orally saying?
I am writing as well.
Ah, it is not visible. Okay.
Okay, so you can tell me if you can see it or not. Anyhow, so I will write it again. GP is writing this letter back to specialist. The case was right total knee replacement surgery. It was uneventful surgery, right? And now we are writing for the follow-up so that he can make sure that patient can use the frame or stick as per requirement. We can move on. Let's say there is some medication list the patient has to take, whatever, 1, 2, 3. Let's say Mene, Nocte, PRN. So list of medication, right? And let's say repeat FB INR as the patient has some like instruction given in the case note because of the patient INR was not good in the ward. So now you can see this is an instruction that specialist is referring back to GP, not the GP is referring back. Sorry, this was my mistake. So anyhow, in this case, if letter of discharge, I can write it down. I'm writing this letter regarding Mr. XYZ. Let's say I'm writing regarding whatever patient name is who underwent a successful right total knee replacement surgery. Okay, he is or she is ready to be discharged into your care for follow-up. Now, this is a letter of discharge. I'm writing regarding Mr. XYZ who underwent a successful total replacement surgery. He is ready to be discharged into your care for follow-up. Let's say. Then we have another case can be written in this way. Let's say if you are writing this letter, being a specialist to GP, and the patient was admitted with worsening symptom of schizophrenia, right? With worsening symptom of schizophrenia, you have started some medication management in hospital, right? And to which patient responded. There was some nursing management as well. Now we have discharge plan. So we can just write down, I'm writing to discharge Mr. XYZ who has responded well to the treatment of, let's say, blah blah, schizophrenia, and is being discharged today into care for further follow up. So, this was a letter of discharge, like two cases we have discussed. In the cases of OET medicine, most of the time GP is being the audience, but in case of nursing, you can see that you would be, let's say, a ward nurse, and you will be writing this letter to a community nurse until and unless if the ward nurse is not referring back to the resident home nurse where the patient is a resident. If you are writing this letter to resident home nurse or patient is living in a nursing home and you are writing to the head nurse in that clinic or the resident home nurse, in that case you will not write on social plus past medical history. But in your case, like of the nursing, when the ward nurse writing to the community nurse, maybe writing to the home care nurse, maybe. So depending upon the task, let's say if you're writing the community nurse for the follow-up plan, which includes medicine compliance, wound care, for the home nurse, let's say for the wound care, medicine compliance, right? And so we can write it down in your case, the social plus past medical history, if it's relevant. However, the discharge can be written in the same way, like I'm writing to refer Mr. XYZ, who has responded well to the treatment of blah and blah, and is being ready to be discharged today into your care for further follow-up. Or I'm writing to request you regarding Mr. XYZ, who need your services at his or her home, right? After the discharge, as he or she had undergone blah blah procedure and she had responded well to the treatment of blah and blah for ongoing further management. So this is something that we have discussed about letter of discharge. If you like to ask any question, please feel free to ask. So moving on to the next type of letter, we could have a referral letter type, but same specialty referral, like specialist to specialist referral. On 23rd July, as per the student response, they just quoted that we have a referral in which we are writing this letter, like a surgeon was writing to surgeon. I don't remember the exact detail, like what was the detail, but in anyhow, you can see the same specialty referral. So let's make the case over here. For example, if there is a psychiatrist, like say emergency psychiatrist, and he or she is writing to the his primary psychiatrist. For example, even GP is writing to GP. For example, like endocrinologist, rhinologist is writing to endocrinologist. So whatever the case is, it could the most of the time these cases, same specialty referral could be due to second opinion, could be due to patient insistence or relocation. So in case of medicine and nursing, it's easy, but in case of pharmacy, if you can see this case, being a pharmacist, you will be writing to new GP as the patient is not satisfied from the previous GP. So if you can see, like in this case, it's a bit close to your this GP to GP referral, because being a pharmacist, you can write it down the letter. You can write it down the letter to the maybe new GP on the patient insistence, and the patient was not happy with the previous GP, right? So now, if we have the same specialty referral, so the reason I mentioned either it's a second opinion,
Draw करना है.
either it's a patient insistence, or either it's a relocation. So we can have these following options that we can expect in the same specialty referral, right? So again, the focus or the reason of writing should be kept in mind before writing the same specialty referral, right? So we'll give you an example. Let's say if there was a case like GP was writing to GP. This was the patient GP for the last 10 years, and this was a new GP. Now patient was relocating this area. Now patient was relocating to this new area, and actively right now the reason of referral was management of anxiety. So we can see, and yes, obviously it's basic. You can say handover. It's a complete handover. So we can write it down in this case. Whatever. First of all, make sure one thing in this letter. When you are writing this letter to GP, to new GP, Before we can see why we are writing, one thing to be kept in mind that all information should be included in the letter. So we cannot say which is relevant or not relevant. In organization, if we are referring this letter for the management of anxiety, so anxiety focus. So after in the intro, you write it down. Let's say I'm writing regarding Mr. XYZ, who has been under my general practice, who has been under my treatment for the last 10 years. However, as currently, let's say he or she is moving to blah blah area. For that reason, he or she is anxious, and he also so please note that he has a history of anxiety. So I would appreciate if you could further assess or manage this case. Introduction. After introduction, the next paragraph of the body, you would be focused on the like anxiety thing only. And right after the anxiety, you can write it down the secondary complaint. Secondary complaints, right? So according to the importance. So to give you an example, like in the same specialty referral, most of the time it's the relocation, okay, or maybe the patient satisfaction. So at this point of time, do you like to ask any question? Please feel free to ask me.
Sir, if the GP, if the patient,
This is a letter that everyone can respect, irrespective of your profession. The letter of request. So, being a doctor or nurse, you can write down this letter, or maybe pharmacist to, let's say, doctor can write down this letter to nurse. Mostly in OT medicine, doctors are writing this letter to doctor and nurses to nurses and pharmacists to the patient. But less likely they will write down to the GP or to the nurse. Anyhow, so let's say if you are writing this letter to a nurse request, it's one of the type of letter where you have to request the nurse, let's say, to pay a home visit. Sorry. We also have a letter of request to other allied healthcare professionals such as occupational therapist, right? Such as occupational therapist. We also have a letter to a social worker. So in OED nursing, we have this letter most of the time, but we can expect in the medicine as well. So let's say, so to understand your, you can say, understanding to the course of the writing right now, if we are writing this letter for a patient who had just have right hip replacement and we are discharging for the wound care, right? For the wound care, and the same plan, let's say, we can say stick or frame. Let's say we have air mattress, right? We have IV drips, whatever has been mentioned. We have the medicines, and it's also being written in the case that patient has depression required during ward stay. Now, with these details, I'm writing this letter to social worker. Now, writing this letter to social worker. So if you remember, all the details was not that much relevant to the social worker, and we are referring or requesting the social worker to help the patient so that he can, right? So to help the patient to resume normal life. So basically, now we can see I'm not writing this lay, I'm writing to refer this patient who underwent a right hip replacement surgery and is being discharged today into care for further follow-up treatment. This will not be the right introduction. If this letter, if we can write it down this letter in this way, I'm writing to introduce Mr. XYZ, who has depression acquired post during her post-operative stay in ward when he transferred after his successful right hip replacement. Hence, I would appreciate if you could help her or him to resume his normal life. So now you can see this letter is being written to a social worker. So we can be more focused on the social related things. Let's say as his patient history, like he's living alone, like social history, really more important for social worker. If there is any games he's playing or if there is any factor that can be contributing, we can write down over here, right? And number of family members, the type of home he's living in, and so on. As you can see that this is a few types of letter that we discuss. A letter of request as well to a social worker, maybe to the physiotherapist, to occupational therapist, and so on. So I hope these types of letter would have make some sense to you. If you like to ask any question, please feel free to ask me.